Compare and contrast the anatomical structure of arteries, arterioles, capillaries, venules, and veins. Blood vessels form a continuous network that transports blood throughout the body, but their structures vary significantly based on their specific functions and clinical relevance. Arteries are thick-walled, muscular vessels that carry blood away from the heart under high pressure. They have three main layers. The innermost tunica intima, a smooth endothelial lining that reduces friction. The tunica media, a thick layer of smooth muscle and elastic fibers. And the tunica externa, a tough outer layer of connective tissue. The robust muscle and elastic tissue help arteries withstand and regulate the high pressures generated by the heart, and are what makes pulse points palpable during physical exams. Clinically, diseases like atherosclerosis, which is hardening and narrowing of the arteries, can limit blood flow and increase the risk of heart attacks or strokes. Arterioles are smaller branches of arteries with a similar layered structure, but a proportionally larger smooth muscle component relative to their size. This prominent muscle layer is crucial for regulating blood flow into capillary beds and for controlling systemic blood pressure by adjusting vessel diameter. For this reason, arterioles are a primary target for many antihypertensive medications used to treat high blood pressure. Capillaries are the smallest and thinnest blood vessels, consisting of just a single layer of endothelial cells and a thin basement membrane. They lack muscle and connective tissue layers, making them ideal for the rapid exchange of gases, nutrients, and waste products between blood and tissues. Their thin walls and small diameter also slow blood flow, maximizing the opportunity for exchange. Clinically, impaired capillary function, such as in diabetes mellitus, can lead to poor tissue perfusion, delayed wound healing, and an increased risk of infection or edema. Venules are small vessels that collect deoxygenated blood from capillary beds. Their walls are slightly thicker than capillaries and may contain some smooth muscle, but they remain more porous than arterioles. Venules play a key role in inflammation, as white blood cells can pass through their walls to reach affected tissues. Veins return blood to the heart under low pressure. Structurally, they have three layers like arteries, but with much thinner walls, less smooth muscle, and less elastic tissue. Veins have a larger lumen, or internal diameter, which allows them to hold a greater volume of blood and serve as reservoirs in the circulatory system. Most veins, especially those in limbs, contain one-way valves to prevent blood from flowing backward against gravity. If these valves fail, blood can pool, leading to conditions like varicose veins or increasing the risk of deep vein thrombosis, or DVT, which is a blood clot that can be life-threatening if it travels to the lungs. Despite their structural differences, all blood vessels work together to ensure continuous blood flow, maintain appropriate pressures, and facilitate the essential exchange of substances throughout the body. Understanding these differences is crucial for recognizing and managing a wide range of vascular and cardiovascular diseases in clinical practice.